Dear students, let us start learning various case or scenario-based descriptive questions, MCQs, and reasoning questions that can be asked in physiology with the explanation. A male aged 40 years, Mr. SFR, underwent gastrectomy for his stomach cancer. Gastrectomy is a procedure where a part of the stomach will be removed. After the gastrectomy, he started developing features like dizziness, weakness, he was lethargic, losing balance while he was walking, and also few features like numbness and tingling sensation in the lower limbs. Examination shows pallor present and glossitis. Glossitis meaning is inflammation of the tongue, as you can see in the picture. Investigation shows hemoglobin level 8 gram percentage, MCV 110 femtoliters and MCHS 40 micrograms. Now what is the probable diagnosis? So the probable diagnosis here is megaloblastic anemia due to vitamin B12 deficiency. Now what are the common causes for B12 deficiency? B12 deficiency is often seen in strict vegetarians whose intake of vitamin B12 will be very poor. So the common sources of vitamin B12 are egg yolk and meat and milk products. It is also seen in persons who take sufficient amount of vitamin B12 but it is not getting properly absorbed, like decreased level of intrinsic factor of Castle. Intrinsic factor of Castle is released from oxyntic cells of the stomach. This factor combines with vitamin B12, forms a complex, and this complex reaches to the ileum where it gets absorbed. So anything which reduces intrinsic factor of Castle leads to B12 deficiency. So this is often seen in gastric atrophy or gastrectomy and also in intestinal sprue. Intestinal sprue, also called tropical sprue, is a kind of disorder where we see malabsorption which is affecting the small intestine. What is the cause for anemia seen in B12 deficiency? Now we should now discuss why a person having B12 deficiency should develop anemia. So vitamin B12 is required for thymidine phosphate synthesis, which is one of the building blocks for DNA. DNA is required for proper cell maturation. And the RBC maturation, which is also called erythropoiesis, what happens is the size of RBCs keeps on decreasing. A person who have B12 deficiency will have reduced amount of DNA formation, which leads to a reduced amount of RBC maturation. This results in formation of large sized RBCs, which we called as macrocytes. And these macrocytes, whenever they squeeze through capillaries, they lose their fragility, and so this kind of RBCs, they are easily ruptured by reticuloendothelial system. So because of this more destruction and early destruction of RBCs, person will end up in anemia. So what is the peripheral smear shows in B12 deficiency anemia is we see large sized RBC which is called macrocytes and normochromic. What are the common features seen in vitamin B12 deficiency anemia is pallor, giddiness, dizziness, shortness of breath, mouth ulcers and tingling and numbness. These are the neurological symptoms often seen in patients with B12 deficiency. What are the common laboratory findings seen in B12 deficiency anemia? HB percentage will be reduced. Peripheral smear shows macrocytic RBCs and normochromic RBCs. Mean corpuscular volume will be increased. Normal is 78 to 100 femtoliters. Mean corpuscular hemoglobin is increased. Normal amount is 27 to 32 picograms. Mean corpuscular hemoglobin concentration will remain normal. Serum vitamin B12 level will be reduced and normal is 200 to 900 picograms per ml. Now let us see various scenario-based MCQs. What is the blood picture seen in B12 deficiency anemia? I hope all of you know the answer. What is the answer? Yes, the answer is macrocytic normochromic anemia. Some of the reasoning questions that can be asked is, why macrocytes are seen in vitamin B12 deficiency anemia? Why anemia develops in vitamin B12 deficiency? Why anemia develops in gastrectomy patient? So these are the various reasoning questions that can be asked. I hope we discussed the answers to this. Any queries, you can mail me. Thank you for careful listening.